Simcoe, Muskoka. We now have a total of 51 cases reported on our website, and in addition to that we have another 3 that have come in this morning that we haven't had time to further investigate. So I'll speak to up to the 52 cases, starting from where we left off yesterday. Yesterday we had 44 cases, so I'd be speaking from that point onward. I always like to go to the big picture, look at the total tally. So if you look at all the cases and have a look at our website, you'll see that the majority are, as I'd indicated before, of the middle age range from 35 to 64. We do have 14 that are 65 and older, and we now have somebody in their teen years. That's a new case. The great majority of our cases are on self-isolation at their home recovering. We do have 9 who've recovered, and we have 8 hospitalized. As I indicated before, we've very unfortunately had 4 who've deceased, and we've had others that, one other that has actually gone out of country, originally from the UK. If you look at how people acquired their infection, the great majority are travel-related, 30 cases, and we have 9 that are close contacts to cases, 11 that are community acquired, and by that I mean that they didn't have an identifiable contact related to travel. They hadn't traveled themselves. They hadn't had contact with a known case. And to me, that is an area of great concern, as I've always pointed out. This is evidence that there is transmission happening in our communities, and therefore people need to protect themselves. They need to exercise the physical distancing that we've been talking about all along, maintaining that 2-meter distance from other people, really thinking twice about whether or not you need to go out. When you go out, avoiding crowds. And if you develop any signs of illness, that you need to be staying home and self-isolating for 14 days or until you recover, whichever period is longer. So definitely want to be protecting others in this, protecting family members in this. You want to protect yourself in this situation as well, hence the physical distancing. Right now is the time for us to be exercising all of this, to flatten the curve, to do all that we can to avoid transmission in our communities so that we don't get a big surge of cases overwhelming our healthcare system. We've been giving this message for over 2 weeks now, and we hope, in fact, that we're having an impact. I would say the fact that our daily case count is not continuing to increase above the day before is a good sign for us. I say so with guarded optimism. We need to keep this up, and we do know that for every case there can be many other people that are a case that we just don't know of, people who haven't been tested for a variety of reasons. So back to the message, people need to assume that when they encounter other people, those people could be infectious, they could have the virus. It isn't necessarily obvious. Sometimes people have no symptoms at all and are still able to transmit, or they're in early infection and they don't have much in the way of symptoms. So people need to be protecting themselves and others with the physical distancing. The other thing I would say is the travel cases. They still remain important as a means of transmission. We're still getting a lot of travel-related cases. If you have a look at the listing that we provided on our website, we still have among those cases from 45 up to 51, we still have 2 that are travel related. We have 1 that's community acquired and others that are close contacts of cases. So travel related cases are still important. People are still coming back to our community from travel, and it is now required by the law, the federal government, that they go into self-isolation in their home for 14 days and remain in their home, not going out, not going shopping, not even going out for a walk. You have to stay on your property for 14 days. And if you show any signs of illness during that time, then you need to consider yourself as potentially a case and remain in isolation until you're fully recovered or 14 days after the onset of your illness. And if you're a healthcare worker, you really need to be assessed for testing before you'd be able to return to work. Certainly people in that situation, they develop symptoms. If they have severe symptoms, then they need to go to the emergency department to be taken care of. If they get severe shortness of breath, for example, they need to go to the emergency department. There can be a substantial number of people who become ill with this. So, like severely ill, it's more 20% of cases can be very ill. You can have as much as 2% of cases overall in Canada that die from this. So just a message for people to take it very seriously. If we look at our most recent cases since yesterday, we still have a somewhat of a predominance overall of men in our case count, 29 out of 22, but if you look at the most recent ones, we have more females than males, 5 females, 2 males. The age range of the cases is between 10 and 60. As I said, we've had our first teenage case, and we've had, as I've mentioned, 2 related to travel, 3 related to close contact. To date, I'd indicated that of all of our cases, 6 of them are Muskoka, but none of the cases that we've had in the last day have arisen in Muskoka. So just go over a few points for today, some key messages. It's important for everybody to know that the province Premier has issued a new directive, the closure of all outdoor recreational amenities across the province. So parks and outdoor playgrounds and skateboard locations, all of those sorts of locations are closed to the public. So picnic areas, park shelters, outdoor exercise equipment, condominium parks and gardens, and other outdoor recreational amenities are all closed. And this is in order to help with that physical distancing. Those locations have been found to be places where people tend to come together and potentially get exposed, and so the province has decided to close them to help support the whole practice of physical distancing. For people who are in isolation because of travel or because they've had a contact with a case, they need to remain at home. They cannot go out. You cannot go out shopping, for example. You need somebody else to be able to do that kind of thing for you or pick up your medications. Can't have visitors. But what I would say is that there can be people that have a hard time with that, of course, meeting their needs. And so 211 is an option for people to call in order to have deliveries of that nature to help them out. And we have some information on our website that promotes that. Simcoe County has been promoting that service. I would say for everybody else, if you're not in isolation, I have said that you need to be thinking twice about going out, but there are still, of course, good reasons to go out. Everybody needs to be able to do some shopping, whether it's medications or food, and to get fresh air and physical activity. So it's important to be able to meet those needs, but you need to do it in a way that protects yourself, that physical distancing, the 2 meters, avoiding crowds and avoiding people who are ill, and staying in if you're unwell yourself. I've got some good news for Muskoka. The assessment centers in Huntsville and Bracebridge are both coming online today. They're both opening today. And that's a day earlier than I'd said yesterday, so I'm quite happy about that. And there's more information about that on our website. The Chief Medical Officer of Health has now recommended that people above the age of 70 should isolate, should self-isolate, should stay home and avoid contact with other people, avoid having visitors in, have other people go out and meet your needs, buy your groceries, etc. And this would be indefinite until we get to the point where the risk is reduced again at some point in the future, which I predicted will be probably months from now. So that I know is a hardship, but that is the advice of the Chief of Motion. It is because older people are at a higher risk of having complications, having to be hospitalized, and dying from this. We've had some questions about masks and their use. It's a complicated thing for healthcare workers. We have quite detailed technical information on our website in support of the province's direction on the use of masks in healthcare settings by healthcare workers. But we are not recommending that people would use masks out in the community for everyday use. They can create a false sense of security. People can end up inadvertently contaminating their hands by touching it and then touching their eyes, which can then lead to infection. What's much better is that people concentrate on the physical distancing practices, the frequent hand washing as an intervention, keeping the 2-meter distance from other people, staying away from crowds, and that once again that you go indoors and self-isolate if you develop symptoms. Workplaces. Many workplaces have been closed down as non-essential services. This is meant to reduce the risk of transmission of COVID-19 in the work environment with people close together. And I note in the media that Toronto Public Health actually had to close one of its offices because they had some staff come down with COVID-19 in the office, and thus they've closed that office, sent people home, and only have minimal staffing there, people using personal protective equipment. Here at Simcoe Muskoka, thank goodness we haven't had that happen to us yet, but we're well aware of, like any work environment, the risk. We have a lot of people together in a place. It's possible that somebody would come into the environment who they don't know that they have COVID-19, they may not have symptoms or very mild symptoms, and it could lead to then many of us being exposed. So we're well aware of that. We are now doing screening of people coming into our offices, but we're also very actively setting up our staff to work from home and get as many of our staff not in our office but working at home to comply with what everybody else is doing with their work environments and to reduce the risk. If we reduce the number of people coming to our office, we reduce the likelihood that somebody will come here that is ill or infectious but not yet ill, resulting in others being infected in our office environment. We're working hard to protect our staff in this way. So at this point, I have worked through my notes here, and I would be happy to take questions from those participating today.
Okay, thanks, Dr. Gardner. We'll start with Chris Simon.
Oh, thank you. There are being media reports about a coffee shop owner in Barrie being confirmed as having tested positive with COVID-19. As we begin to maybe see some of these cases of retail shop owners, coffee shop owners, restaurant owners who were testing positive with this, what would be your recommendation to their patrons and staff? Should they be going into self-isolation or wait for the health unit to advise if there may be contamination?
Mm-hmm. So I always have to be protective of people's privacy, so I wouldn't be speaking specifically about whether, the details of this individual or other individuals on my list, but what I can assure you is that in each and every one of these cases, through a detailed history that we take of the individual and their family members or their immediate household members, we identify everybody that they've had close contact with, whether it be in the work environment or their home or their social circles, and we arrange for those people to go into home isolation for that 14-day period, and if they develop symptoms, then we arrange appropriate follow-up for them and potentially their contacts. So my advice would be that we will get to people when there's somebody who's got a test that's positive. It comes to us and we follow up with them. I would also say, though, that we all need to be aware that you don't know what else is out there. For every case that we know of, there are undoubtedly many others we don't, because they can't be tested, they can't get to testing, they might be asymptomatic. This talks about the risk of community transmission. Therefore, everybody needs to be practicing these general precautions that I'm speaking to, the physical distancing that I'm speaking to, and self-monitoring. And at this time, we're taking everybody's illness seriously. We've moved away from the requirement that you have had to have had a direct contact with somebody who's a known case or have had to have traveled. And now, if individuals are ill, they need to take that seriously and put themselves into home self-isolation, and if they develop severe symptoms, get assessed, or if they belong to certain groups such as healthcare workers, they need to be assessed and tested. So a general protective approach for everybody would be my message.
Okay,
Yeah, and last week, Dr. Gardner, you talked a little bit about weeks for results. Can you just give an update? I believe last week it was about a 6-day wait tests were taken, and when you were getting results.
We're getting a fair amount of background noise. I don't know if there are others that aren't muted. I'll just ask if they could. And just to clarify, maybe you could tell me a bit more about what results you're thinking of? I'm not quite following.
The provincial laboratory testing for positive or for COVID-19 cases. We've talked previously about there being a backlog in the system, and I'm just hoping for a bit of an update to see whether some of those cases are being cleared more quickly now.
So our lag time for testing has shortened, I'm happy to say. So it's now 3.3 days per case. It had been over 6 days, perhaps a few days ago. So that's an improvement. The province is increasing its testing capacity and the volume of tests it can do, including involving some hospital laboratories in the Toronto area. So I think that's starting to bear some fruit.
So I just want clarity, the 3.3 days, that's Simcoe, Muskoka, or is that province-wide?
That's our data here in Simcoe, Muskoka, our cases. And that's actually the most recent cases.
Okay, Erica, question?
Yes, in Collingwood, the assessment center has been moved to a same-day clinic away from the hospital. Was the public health unit involved in that decision, and what went into that?
So I personally don't know about the details of that, but I do have staff that are linked with each of the assessment centers. I could look into that and give you more information tomorrow.
All right, anything else, Erica?
Yeah, I wondered if there's any word in your discussions with the province or other health units about increasing the number of tests being done and opening up the standards for when you would be able to test someone.
So the province is very actively pursuing increasing the volume of testing and shortening the turnaround time. But at this point, I think there's still some need for prioritization, focusing on those that are severe cases, those that are healthcare workers, those that are in long-term care facilities, also those living in remote communities where their access to healthcare would be much more limited, and people who are living in First Nations communities. The ideal, of course, would be that you could test liberally and test everybody who may be a case, and there have been countries that have had success in reducing ultimately transmission, but also severity of cases with the identification of all cases. I would say that here, I was asked before, why do we have a fairly high case fatality rate? It was in the range of 10% of our cases. Now it's down to 8% of our cases, with our 4 deaths out of our 52 cases line listed. And although I indicated that the numbers there might mean that that's not statistically significant, I think it also might very well mean that we're not seeing as many of the community-acquired cases as we should be. That we're only seeing the severe community-acquired cases for the most part because of the testing focus. Those criteria that I've listed would tend to take you away from finding as many of the community-acquired cases. So there's a risk in that the public may not take as seriously the risk of community transmission if we don't see as many of those cases as actually exist.
Okay, Doug Cross.
Oh, so, Dr. Gardner, do you expect a spike in about a week, 10 days from Muskoka now that these assessment centers are open? And I'll give you a part 2 there. What's people's expectations be now that that center's open in terms of visiting it? Do you have protocols about phoning, telehealth, etc.? People can't just show up on a whim, right?
Yeah, so I'll answer the second question first, which would be my understanding is that they would want a referral from their family practice to go to the assessment center, according to the information I was given today. So people should still be calling their family physician or telehealth in advance of going. And it's also day 1 for them, so I think that they probably have some work to do before it's as smooth an operation as it will be. I do expect that there'll be some increase in the number of tests showing cases in Muskoka with assessment centers going now. You'll have more testing and the ability to find more cases.
Thank you. Nathan.
Yes, hello. Good afternoon, Dr. Gardner.
Good afternoon.
I just wanted to ask you about the new assessment centers. So we have one here in Huntsville, one in Bracebridge. Is there any concern with the older population who stops by? Because I know we're not having walk-in visits, but still the older population is the most at risk. What precautions are in place for when people walk in? Is the whole place scrubbed clean?
I am certain that they do sanitation well. I don't have detailed information on how they're doing their line management or bookings. I do know that at other assessment centers they've either had drive-thrus, which space people appropriately because of how they're coming in, or they book them and have them come back so that there isn't a line. I will look into the details about the Muskoka site and have that information for you for tomorrow.
Great. Second question. With the unfortunate deaths with the elderly population over in Boscagen, have you been in communication with Hospice Muskoka to make sure something like this doesn't happen again?
We've been very much in close communication with our long-term care facilities and have made sure that they're well aware of the screening protocols that are required for staff and patients and the restrictions, prohibition really, of visitation. And made sure that they have swabs necessary for testing and are following all outbreaks. We've had no COVID tested positive outbreaks in Simcoe, Muskoka to date, but this is the time of year in which, through the winter really, that you have frequent outbreaks, and much of the time the test results don't show us what the organism is. So this is something we are following very, very closely, given what has happened elsewhere in the province and the very high risk in this kind of setting.
Thank you.
You're welcome.
Thank you, Nathan. Brett Glover.
Thank you. Doctor, we're seeing folks still flaunting these emergency orders for not practicing safe physical distancing. At what point would medical health officials call for a complete lockdown?
That decision ultimately would rest with the province. I'm always hopeful that we don't have to go to a complete lockdown where you have restrictions on the ability to leave your home without authorization of some kind, without notification that you're going to do something very specific such as shopping or going to an essential service that you provide, because that would have very unfortunate and negative impacts otherwise on our quality of lives and potential to be physically active and on our mental health. So I'm hopeful that we don't have to go there, but that is a tool that rests with the province, and if they find that we're not getting the kind of control on new cases and surge in hospital with the measures they put in place, then it is something they may choose to do.
Could you describe how a hospital could become overwhelmed for those who aren't aware?
Could I describe what would happen? Is that your question?
Well, the method by which a hospital, too many cases, many cases, everything else on top of it, shortage of medical supplies, how does that work?
So fortunately, we're not in that situation here, although I would say that the access to personal protective equipment for infection control is quite limited in healthcare facilities right now. So there is a risk of running out of masks and gloves and such, and that risk would go up greatly if you actually get a surge of cases, because then you would have many more patient encounters requiring use and disposal of that equipment. So that would be one way in which a surge would impact on things. Another way would be hospitals simply running out of beds, or running out of intensive care unit beds, or running out of ventilators that are required for sustaining life for the most severe cases. That kind of thing has happened in Italy and is impacting on New York City right now. My understanding is that New York City, they've set up field hospitals, tents in hospital parking lots and other locations to expand their capacity to provide care, to have additional beds. But we haven't had that kind of impact here yet. And I would say that the healthcare planners are looking very seriously at how they would change in that kind of way if they have to do that. If we're very fortunate and if we're very good about our physical distancing and the public health control measures, the infection control practices that we all need to be doing in our communities right now, then we can greatly reduce the likelihood of having that kind of an outcome. Our own mathematical modeling of cases using a model from the University of Toronto, Delhi Lana School of Public Health, indicates that we can reduce transmission and reduce the number of cases that will occur in our community by 95% if we're very good about the physical distancing practices.
Thank you very much.
You're welcome.
Okay, thank you. James? Are you with us, James? Okay, we'll move on to Mandy.
Hi, Dr. Gardner. I just want to ask about the new case number 49, the female intercede. If you can give us any more details, was it close contact with a family member, friends? Do we have any more details about that?
So that individual did have close contact with another case, and other than that, I think I would leave it. You've got basic information. They are at RVH. They are a young individual, and actually the one in the teen years, and they're at home on self-isolation.
Sorry, you said they are at RVH, or they're at...
They have been tested at RVH. They're they're tested at RVH, and they're on home isolation, self-isolation.
Thank you.
Any follow-up, Mandy?
No, please.
Okay, is there anyone who has come on since we signed in? All right, that seems to wrap up all the questions we have from the meeting today, Dr. Gardner.
Have a good day, everybody.
Thank you. Bye,
Thank you very
everyone.
much.